I'm joined by Dr. Blair Davison of St. Pat's for another edition of Morning Rounds. Thanks for waking up with us today.
Well, thanks for having me.
Of course. Today the topic is psychiatrist. So what is a psychiatrist?
Well, I am a psychiatrist. I'm also trained as a pediatrician, but a psychiatrist is a medical doctor who specializes in brain-based mood and behavior disorders.
Okay, so what is the training to be a psychiatrist?
So the training to be a psychiatrist is long, and because psychiatrists are medical doctors, we go to college and then we go to medical school, which is 4 years. And then following medical school, we do a residency in psychiatry, which is specialized training in the field, and that is a minimum of 4 years. So for instance, I went for 5 years because I have additional training to work with children and adolescents, but the general amount is 4 years.
So what's the difference between a psychiatrist and a psychologist?
Exactly. So this can be confusing. In fact, I always joke that even members of my own family don't always know what the difference is. So the big difference is that psychiatrists are medical doctors. We've gone to medical school, we care for the whole patient, all the physiology, all the pathophysiology, all the disease states. Psychologists are not medical doctors. They have advanced training. They've been through college, been through advanced programs at universities. So one of the big distinctions is that while they have expertise in psychotherapy and evaluation and testing, they don't prescribe drugs.
Okay, so what treatments do a psychiatrist offer?
Right, so we also have training in psychotherapy, talk therapy, but we prescribe medications. We also provide general medical care. So if you come to see a psychiatrist with a problem, you may think it's related to a brain-based mood and behavior disorder, but we may realize that, oh no, actually it's an endocrine problem or it's some other organ system. So we do general medical evaluation, but then we also do other treatments like deep brain stimulation, electroconvulsive therapy, not just talk therapy and medications.
Okay, so what's it like to see a psychiatrist then?
Well, it can be frightening because it seems so out of the ordinary, but really most initial visits are somewhere between an hour to 90 minutes, and there's a lot of talking. So come prepared. You'll be asked a variety of questions that are wide-ranging, questions about your family history, questions about your general medical history, as well as have a physical exam where your vitals are taken, weigh and measurement. And then, as I said, a lot of questions about symptoms, how you're functioning, what your stressors are, what your supports are.
And how do you go about finding a psychiatrist if you feel you need one?
Yeah, so that can be tricky because we have a severe shortage of psychiatrists in the nation. Across the nation, there can be up to a 6-month wait, which is, frankly unacceptable. So here we have better wait times by a little bit. But what you need to do is see your primary care provider, talk to them about your concerns, and then get a referral. Because sometimes you may need to see a counselor or a psychologist before going to see a psychiatrist.
All right, well, thank you for answering some of those questions for us this morning. If you have any questions you'd like us to answer, you can email them right to us. morningrounds@kpax.com.